The memory loss is one of the first symptoms which appears when Alzheimer's disease is declared. When the illness evolves, patients can hardly complete their daily tasks. When it's getting worse, they have normal landmarks concerning time, space, and money value. Then, they may have issues to communicate because of damages in some parts of the brain. This affects their personality and, of course, their social life. So, Will's behavior is not surprising at all. On the one hand, neurons die, and the connections between them are broken. On the other hand, proteins deposit on and into neurons. These proteins disrupt the function of neurons and induces an atrophy of a part of the brain named hippocampus. It produces a neurotransmitter called acetylcholine. This one is essential to carry electrical signals from a neuron to another one. So, when the level of acetylcholine declines, it causes atrophy in other parts of the brain, essentially in the parietal and temporal lobes, which are linked to memory and language. Yes, by the way, it's only getting worse and worse. Not yet, but patients' cognitive symptoms can be stabilized by maintaining the level of acetylcholine. For psychiatric symptoms, if patients feel depressed, I would rather consulting a psychiatrist to simplify the patient environment. If it doesn't work, drugs can be used, such as antidepressants, anti-anxiety, or some treatments for sleep problems. Yes, I think a doctor was absolutely right. You can also protect your house like you would do for a child. That means taking down drugs and to reduce the risks of injury while cooking, for example, if you're still able to cook. Proper nutrition, sports, and social activities are important to keep patients as healthy as possible. Vaccines prevent the development of proteins in the brain, but nowadays it induces inflammations. Unfortunately, Alzheimer's disease might be linked to genetics, and there is a huge work to understand genes' troubles.